Welcome back, everyone. We're now starting our session after morning tea. My name is Marian Baird. I am Professor of Gender and Employment Relations at the University of Sydney and a Chief Investigator on the Mature Workers and Organisations stream of CEPAR. In our policy dialogue events, we always try to include international speakers. Of course, this year it has been a bit harder given COVID. So it's with enormous gratitude that I'm going to introduce our first Keynote international speaker. I'm going to introduce to you Professor Linda Duxbury. Linda is Chancellor's Professor in Management at Carleton University in Canada. And Linda has over many years conducted numerous national Canadian studies on work, health and family. She's an expert on various areas of employment, employee wellbeing, work role overload and workforce change. And she is currently studying the impact of technology, generational differences in work values and the way in which people are working in Canada. I've known Linda for many years and count her as one of my best international friends in academia. And last year when we were to have this conference in person, we were quite excited about bringing Linda over. Unfortunately, that didn't happen. And so this year, asking Linda to present via Zoom from Canada at 9 p.m. at night, I want to say that we're extremely grateful. Really looking forward to hearing your presentation, Linda, on recruiting, retaining and empowering the mature worker from a Canadian perspective. Linda will present, and all of the people in the audience here in person and those who are joining us via the World Wide Web or the internet or whatever it's called, will be able to see and hear Linda as well. After Linda's presentation, we do have time for questions, and those questions will have to be run through me. If you're in the audience here, I will repeat the question to Linda. And if you are wanting to send a question in from where you are watching via your participant link, you can open the Slido website, sli.do, and put in your policy dialogue code after the hashtag in the top field. You should be able to see that. And go to the CEPAR event webpage and pop your question in there and it will come to us. So we will be able to have interaction after Linda's presentation. But now I'm going to hand over to Linda and very much look forward to hearing Linda's insights. And I'm sure she would challenge us in some ways on the mature worker, the Canadian context. Thank you, Linda.
So I'm assuming everybody can hear me. And I'm going to show you my slides big and me tiny as opposed to me giant, which is fairly terrifying, quite frankly. I'm absolutely delighted to be here. I would be much more delighted to be there, but what can we do, okay? So as Marian said, I do work-life balance, stress, employee well-being, and actually a huge part of my life right now is a huge survey we're doing on employee well-being in times of COVID, which we've already got 26,000 responses. We've also been interviewing Canadians since March 2020 every week on COVID. So I teach in a business school. And my focus really is on making the business case for change around dealing with anything to do with employees. When I first started my career, which was a while ago, and hope that's why it's better you can see me small, because then you'll believe that. But when I first started my career a while ago, I was quite naive and I believed I could make the moral case for change. Your people are stressed, they're burnt out, they're not happy. And you would go, oh, okay, thank you. and change. But that's not actually how businesses work. Businesses want proof. They want to know the cost of not changing, which is a huge focus for them, as opposed to, and also the cost of making change. I also teach MBA and PhD in the area of change. And external drivers of change right now are driving massive government change in Canada. Probably, and Marian and I were talking about this, and she's going, well, we've had COVID too. And I'm going, you have so not had COVID. Maybe Melbourne has had COVID, but the rest of you have not got COVID. We're still on no, you have not. Okay, we are still on lockdown. We can't go across the states. Quite frankly, we can't see anybody. I don't even care about going to Australia. I'd be happy to go to Toronto. But right now, that is also not allowed. On the other hand, because we're way more shook up, that predisposes everybody who's had COVID quite severely, that predisposes us not to need to be convinced about the need to change. I think Australia might be a little further off. So this is not me, this is my daughter. When I first started my research on work-life balance, I had a child. As I continued my career, I had older parents. And so quite frankly, my research now is on balancing work, childcare, elder care, and a huge driver, of course, for me is the consequences of not in terms of balance and well-being. Now, Canada versus Australia, just so you all know, my mother was Australian. My mother was an Australian war bride. My father was torpedoed in the Coral Seas, dry docked in Wollongong. My mother lived in Cronulla. I have cousins on the North Gympie Line. I have a cousin in French's Forest. I've got Australian relatives, okay? And in many ways, you're very, very, very similar. We have similar historical roots. You've got states, we've got provinces, but that means that there's a whole bunch of diversity of policy depending on where you're located, okay? But we're also very different in key ways that relate to this symposium. So Marian said, we want you to talk on mature worker. And I said, well, what are those? People who know how to behave politely, and you can take them out in public because they're mature and they won't embarrass you. And she's going, no, well, we call those older workers. We are not as politically correct as you Australians, apparently, okay? But how we define old depends on mindset. I'm not old, but it also depends on province. So when I looked at StatCan, we define older workers quite a bit older than you, which is 55 and above, not 45 and above, okay? And in 1996, 2.7 million workers, 25 to 34, for every worker 55 and above. At this point in time, the ratio has declined to 1. Aging, and Marian sent me some of the stuff she gave you. We have exactly the same situation here as we had a huge baby boom. And since then, we have an undersupply of youth. And if we don't deal with the issue of balance, that will actually continue. Changes in life cycle. This is where we are right now. So the ratio is 1. If you look, and it doesn't matter what gender, you've got bigger gender differences than we do because Canada has the highest reliance on female labor in the world. We also have one of the lowest number of part-time workforces, and Australia has a much higher. So fundamentally different in terms of that. Right now, 66% of Canadians to the age of 65 are currently employed. So the majority are employed. And in fact, over here, as you'll see later, we're begging them to stay working for us. Please don't go. And they're going, well, our pensions are so good here. I'm sorry, why would I work? And I'll talk to you a little bit about that later. But what I want you to notice is this is people over 65 who are still actively in the workforce. So slightly different situation here. If we look at this in Canada, it's all about education and skills. We're in a knowledge economy. We're in a seller's market for labor. At the high skill end, we have way more positions going begging than we have workers. And if you have the skills the market needs, quite frankly, we don't care how old you are. 50, 60, 70, are you cognitively still there? Okay, we'll take you, okay? If you don't have the skills the market needs, on the other hand, we're brutal. We are brutal. And it's not an age-related brutality thing. It's if you don't have skills, you could be young, and we are not going to care. So the Canadian labor market is bifurcated on education, not so much on age. Overall, older Canadians fare relatively well in the labor market with record high labor force participation rates, clear upward trend in retirement age, where people in many cases love their job and we compensate them well for that. So why has the participation rate of older workers increased in Canada over time? Life expectancy has increased, health has increased. It used to be that, like Australia, we're a lumberjack and we're okay. We were into manual labor, fishing, mining, etc., where they were physically demanding jobs. And as you got older, you weren't able to do them. But now they're cognitively demanding jobs, and actually, older workers bring more experience, more intuition, more skills to jobs, and experience counts. Higher levels of education, Canada, one of the highest levels of post-secondary education in the world. We compete at the knowledge end of the economy, which is why education is important. We're seeing huge cultural shifts here with people valuing work more than retirement. They love what they do in many cases, and they're valued, so they stay. Many Canadians retire and then re-enter the workforce because they loved what they did and need for social interaction, which is going to increase even more after COVID. Older workers, fear of outliving the retirement system, lower savings. Businesses are now more likely. So our labor market is tightened, and we are actually actively focusing on keeping the good, skilled, older workers in our labor market. And I'm going to show you our retirement system, and that's going to make you go, wow, which is something from a public policy perspective you might want to consider. Our retirement plan provides incentives to work, not to retire. Okay, starting in 2013, Canadians were offered the option to defer take-up of what we call old age security beyond 65. And if you deferred, and the longer you deferred, the more, when you actually retire, the more money the Canadian government would give you. We made even more changes to the Canadian pension plan, 2011 to 2016, greater flexibility. And by the way, this is Canada pension plan. Pension is done by the country, not the province. CPP allows individuals to start receiving pension before 65 without quitting working. So you can, in theory now, retire, but still, if you're over 65, you can collect a pension at the same time as you collect a wage. And new post-retirement benefits allows working recipients of CPP under 70 to continue participating in the plan. So the longer you participate in the plan, the more we take your highest earning years, and that's how they calculate your pension. So if you are being paid well, it's to your advantage staying in the market longer, okay? So what we actually, there are a few barriers. I mean, we are not nirvana. We're not perfect. Lord forbid we're not. So, I think, and these barriers either prevent them from remaining employed or push people to retire early. So there is ageism. Though, as I said before, if you've got the skills, ageism is less of an impact. Lack of access to training, and most of the research in Canada say that even if employees are willing to train older workers, a lot of people in the late stage of their career go, "Hello, I'm just not willing to learn. I don't want to go through the bother of learning this now." And we're seeing that a lot of older people, by your definition of older, over 55, 60, with COVID, they just went, "That's it. You expect me to learn." So me as an academic, I had to learn Kaltura, MySpace, Zoom, Brightspace, like all kinds of nonsense, just to be able to do all my teaching remotely and work from home remotely. I love my job or I wouldn't have done it. And they pay me enough that I was tempted to stay. But a lot of people went, "Screw this, not going to do it." Okay. So we're like you, a geographically massive country. And so older people go, "I got my family here. I got my house here." By the way, the housing market has gone insane in Canada and the United States because of COVID, because people do not need to live near their job anymore. Okay, now they want a backyard, they want green space. So, people can't afford to buy houses elsewhere, and they tend to want to stay near their family and friends. So, we can offer them jobs in other provinces, but they simply don't want them. They don't want to move. When I read Marian's stuff, and she talked a lot about flexible work, part-time work, telework, ergonomics, etc. Those are all issues here as well, but not to same extent. And quite frankly, COVID has turned that upside down. And I will talk a little bit about that later. But everybody, 50% of our workforce has been working remotely since March 2020. Okay, so, employers cannot say anymore it's not possible, because employees are going, "Hello, yes it is." And especially my mature workers are going, "You don't want to give me what I'm asking for? I don't need this. I've got the skills. I can work as a contract worker for anybody with the skills I've got." So it's a very different world. Health, well-being, work-life issues, the reality is, even though we've increased life expectancy dramatically, and I'll show you that in a little bit, most people have caregiving issues for their truly aged, which is 80, 90, and COVID has really done a number on that here. Canada, to be honest, has done a shameful job. Most of our deaths have been older people in old age facilities and homes. Same in Europe, same in the United States. We are really examining the whole system, which gives us an opening to examine the whole issue of work and caring, okay? So I love this quote, and Marian loves it too, but a lot of my research is on caregiving. Caregiving not at the childcare end, because Canada is tremendously advanced there. And what we've come out of COVID is saying, we're putting in a national daycare policy. I don't know if you've been following that. $10 a day care for anybody who's working. Okay, great. But how about the elder care end? And there are huge discussions on that, because the reality is there are 4 types of people in the world: those who've been caregivers, those who are currently been caregivers, those who will become caregivers, and those who need caregivers. It's going to affect us all at one stage or another. Increasingly, balancing work and caregiving is going to be an issue for employers, especially for people in the sandwich generation, which falls squarely into how Australia kindly defines them as mature workers. And I use this phrase a lot: elder care is the new childcare. We are recognizing issues and we're bending over backwards to deal with balancing work and childcare. But elder care is a different issue, and I'm going to talk a little bit about that, because this is where I see the big issues for retaining mature workers, at least in Canada. Life expectancy, 47 in 1900. In Canada right now, 84. Okay, so that's why part of the reason we've got such a difference in terms of dependency ratios, etc., is because of this whole issue around aging of our workforce. Increased labor force participation of women. Australia and Canada, quite fundamentally different. We have very generous parental leave policies. Most people remain working, and we don't count on part-time. In fact, part-time is less than 10% of our labor market in both genders, and it's mostly students, not mothers, all right? So that means we have fewer carers. The fastest growing segment of our population in Canada is what we call the fragile elderly. And the fragile elderly, a lot of them actually didn't make it through COVID, but what really shone a light on is how shamefully we've treated those people and the people who are family members trying to care for them. All right. Here's population aging. You can see you're right in the same boat as us. Okay. Delayed parenting. Average age for first birth in Canada right now, 31. And that's when, of course, I had my kids. I was older, and they call me an elderly prima grava. But that's the norm now. And in fact, in North America, we are actually paying professional women to freeze their eggs so they can delay even further. But as we delay and we wait until people are older to have children, and we have fewer caregivers to go around, it means that, of course, by the time their kids are, adolescents or teenagers, they're also going to be caring for their parents. 48% of Canadians between the age of 20 and 29 still live at home. And that number has increased astronomically during COVID because of the fact that universities were all online. Community supports are not there. We talk about caregiving, but it's absolutely, and I don't know how good your system is in Australia as comparison, but it's a nightmare here. It's a nightmare to circumnavigate the system and find care, find support, etc. And 70 to 80% of Canadian caregiving is provided on an unpaid basis by family members. And if they decided, hey, not going to do this anymore, good luck, Canadian government. It would cost us about $25 billion to replace what they give us for free and for love and for duty. Policymakers try to reduce the cost because healthcare is all free in Canada. I'm pretty sure it's free in Australia too. And so we're trying to keep the cost down because it's paid by taxes. So again, if we get people who are working to do it, that's a bonus. 75% of those in the sandwich generation are in the workforce, and most of them are professionals and managers. They play a very critical role because they're mature, and we've got to do something because after COVID, if we don't, we're going to lose them. Why is caregiving an issue? Everybody's confused. It's very interesting. And it's, people talk about their kids all the time, but they don't actually talk about caring for their parents. And many people feel horribly guilty if they can't provide care for their own parents, because their parents were there for them. And by the way, it's a whole nother talk, but that's why robotics is never going to be a replacement for caregivers, paid or unpaid, because quite frankly, people feel reluctant, that to have somebody do that. These issues are not going to go away. They're going to become more profound. Not one of these things is decreasing. And in fact, all of them are increasing because of COVID. In our big study of 26,000, we said, what one issue is keeping you up nights? They were only allowed to pick one, okay? Almost 1 in 5 said the health and happiness of my elderly dependents, okay? And a lot of the rest said, the well-being of my kids or getting COVID myself. Caregiving and childcare are not the same. So the things and the strategies that we need to put in place to support employees are quite different. So my research would say compressed work week is what they want, or remote work with flexibility is what they want to manage work and caregiving, because caregiving is a different phenomena. We've got a lot, childcare is predictable. We've got books, slews of books written. When they're this old, do this. When they're this old, do this. Caregiving is completely unpredictable. And the older they get, the more unpredictable it becomes. So the older they become, the more we have to spend. Whereas in childcare, the older they become, the less we have to do on it. So the need for elder care unexpectedly increases over time, role reversal. And both my parents died in their 90s. And I tell you, I wanted to help them, but they still wanted to be my parent. It was a lot of conflict. Policy solutions have to be different for elder care and for sandwich than for childcare, which means the array of things that you need to be considering here to keep the mature worker in is huge, huge. And it's their choice in many ways, not your choice, at least in North America right now. So COVID disruptions means that change must happen. Change has never been more urgent. And, quite frankly, everything is up for grabs in North America and Europe. Not as much in Australia, unfortunately, I don't think, because we're still at home and we're going, yes, we've just hit the milestone of 75% of Canada has had one shot of vaccine. Our focus is on vaccinate those puppies, get them back into the work. We are still talking about maybe letting people eat outdoors in tables of 4, okay? And most people are still at home. We are not having to make the case of So what happens is the disruptions are huge instabilities in the external market. And the more you're adapted to, tranquility, which is quite frankly where we've been for since the mid to late 60s. We've tinkered around the edges, but we haven't had the profound workforce changes that we're going to see. This is McKinsey. I'll let you look at it, but they're saying disruptions force change. Change is not optional. You can either start now or you can start in a few years. Better start now because they're coming. So you can see every single thing, it's going to increase. In terms of COVID, what they're saying for North America and Europe, the impact on lives and workplaces is the same scale as the Great Depression and World War II combined. Impact on workers and their intent to stay. And we're just, in our survey, we say, think about next year at this time. How likely are you to still be with the same employer, still doing the same job, still working the same hours? Over here, people are going, I've realized how important family is. I've realized how important social interaction is. You're not going to work me to death anymore. It's not 24/7 anymore. Demographic changes, that's still going to happen. We've been so focused on COVID, but this is going to happen. And in fact, that increases the urgency of dealing with the mature worker. We've got 3 generation, and generation is watershed events in the environment that change the values of a population at a particular age. Anybody born after that watershed, and in this case, during the watershed, I've got this. So we've been talking about, oh, look, and I've been in Australia, those millennials, look what they expect. They expect this, they expect that. Well, there's nothing compared to the YOLOs, which is you only live once. Their attitude, and by the way, that's anybody under the age of about 40 right now, is like, hello, I may be dead tomorrow. So you're not going to dictate to me. You won't give me remote work. You won't give me flexibility. Then I won't give you the luxury of employing me. All right. This is Canada right now. Look at our talent shortage. At the skill end, we're going to give them whatever they want. Technology-driven change. And I think we have to start looking at this in terms of the older workforce. COVID has sped up what is considered possible. Many Canadians have worked from home during the pandemic. Over here, I do not know an employer who is questioning the need to explore hybrid work. But in our study of 26,000, 1 in 5 can hardly wait to get back to the workplace. 1 in 5 will only work for you if you give them full-time work at home. And the rest, 60% want hybrid. 1, 2 days in the office, 1, 2, 3 days at home. That is a level of flexibility we have never encountered before. That is what you need to keep workers of all generations in. And if Australia doesn't get it, I can tell you that I do not know of any major employers in Canada, the United States, that are not having discussions right now on how to implement this. It's not a question of can they work at home, can they do compressed work, can they do flexibility. It's how many of these things can we offer in a well-designed suite. Climate change, hey, we're not going to go there. Have and have nots. So that relates to what I was talking about. It's about education, about skills. Education trumps age. And in fact, over here, if Australia doesn't want to keep their mature educated workers, we'll bring them to Canada and we'll be happy. So will the States. Okay, so, and guess what? We can offer a lot of nice things. Okay, we've got the winter. Okay, I will grant you that. Okay, and my cousin who lives in Queensland, I will talk to her about the polar vortex, -30, and she'll send me pictures of asphalt melting in Queensland. You know, I'm not sure one is necessarily worse than the other. Pandemic has increased the demand for a skilled workforce, okay? This is New York Times just in 3 months ago. We can't afford to let early workers retire early. Economists and business leaders have warned of an upcoming wave of automation and digital disruption. Last 9 months of COVID has transformed predictions into reality, accelerated the rate of change. Now we're talking, I'm telling employers over here, you got 5 years. 5 years, that is it. Okay? I'm not saying you got the 20, 30 years. It's immediate now. Pandemic has shone a harsh light on what has already a widening skills gap around the world. Gap has to be closed with an increasing urgency. And that might mean, A, keeping mature workers and doing whatever we can to keep them, and B, reskilling right across the board, okay? So if we look, only 4 types of jobs are not impacted by AI. And most of these jobs, do you see mining, fishing, farming? No, you don't. Physical jobs, we've got equipment that has replaced a lot of those jobs. What we need is people who can strategically plan. What we need are creative people. What we need are people with high EQ, okay? Emotional skills, social skills, technical skills. And mature workers tick all those boxes. You know, so again, it's all part of the same change. I like to show this and I won't, but look at this. So I'm telling, I do a lot of work with accounting. I do a lot of work with insurance firms. 50% of insurance jobs gone in 5 years. 50% of the accounting job, anything that's routine, it will be automated. That's a very different market. And that really changes the discussion, at least over here. So these things, I'm talking about them as silos, but they're all together. Demographics, automation, inequality, and inequality at two levels. One level with respect to, we're not treating, if you're not treating your older workers fairly, then you're not going to keep them, but it's also the haves and the have-nots. So I do a lot of work with healthcare right now because our situation was so bad. I can't even begin to explain it to you. We were airlifting patients from one province to the next, one area of the province to the next. We had very few ventilators left. The hospital in Ottawa, they've got a big tent, like, I don't really think, but what they're saying is, and I think we need to see this, we're going into a fourth wave where in fact, we've got huge, and our data, I mean, I've never seen data like it, okay, in terms of burnout, stress, and that is changing the mindset of people. And in order to be able to keep people, all of a sudden, we're talking about employers showing compassion, empathy, and flexibility. All right? So final thought. You're not just competing within Australia. You have skilled workers who will be poached. When you're talking about this, you have to, you have managed the pandemic brilliantly. I would have to say, we're all jealous. But that might be to your disadvantage exiting because we are all convinced about the need to change, and employers are having a completely different discussion over here at every level, all right? Are you having that level, or is poor Marian having to convince you of the need to do this? As opposed to you going, Marian, for the love of God, we need you to come in and help us now. Everything is in flux. Don't be coming in 2-3 years because you got 5 years max. And if you're not starting now, as I said in this slide right now, anybody who's not managing for the exit now is already too late. And remember, you know, us, we can't shut everything down because of climate change. Mother Nature, oh really? Here's a virus, have a little practice. Okay, oh, we can't do telework, we can't do remote work. How do we know they'll actually work? A little late now, a little late now, have a little practice. So thank you, very close to on time. I'm hoping there's applause. I can't hear it, but I'm hoping.
Yep. Now, can you hear me now, Linda?
I can hear you perfectly.
Great. And you got huge applause and lots of laughter through your presentation. And I've now worked out why Australia has kept our borders closed. We are not sending any skilled workers to Canada. And that's why.
Eventually, you're going to have to open it, you know.
I don't know. So now, look, thank you so much, Linda, for really, I think, putting some pressure on us to think more innovatively and not to be so complacent because we have managed COVID. So let's see what questions, comments, discussions we have from the audience and via Slido.
Okay, so Linda talked about the bifurcation in terms of education in the labour market, and she also talked about how it's unavoidable that employers are going to have to do more flexibility, more remote work, so you could just sort of get on with it. But as we know, the lockdown that we've had, the lockdowns that in Canada, is often high-skilled people being locked down, and low-skilled people, if they've got the job, delivering things to high-skilled people. So the question is, can you have remote work and flexibility for those lower-skilled workers, and how, and whether Canada, how Canada's doing it?
So, Linda, did you hear?
I didn't hear the beginning, but I think I heard him asking about how can you offer flexibility for the lower class, the unskilled workers.
That's
Is
right.
that what you heard?
Yes, and what is Canada doing in that area?
Not a hell of a lot, quite frankly. We don't care as much. But we are having a discussion on it's really shone a light on the value we place on certain jobs, okay? And so, you know, talking about how we value essential workers is cheap. But what we really want to see now is, you know, show me the beef here, show me what you mean. But quite frankly, you know, the Uber driver, the gig economy, the only discussion over here is we're going to be paying them more and the millennials get no more free ride. Right now, a lot of the jobs you're talking about, they're looking at automating. And I know you've got more unionized workers in Australia than we do in North America. But when I work with unions, I say, be very careful about wages. Negotiate instead, not on wages, negotiate on flexibility, flexible work arrangements for lower money. Because the second the wages go too high and it becomes cheaper for a business to automate than pay a person to do it, that's what you're going to see, okay? So the discussions over here that I have with unions and businesses who manage people like that is stop negotiating on salary. It's not all about salary these days. It's about lifestyle and flexibility and flexible work arrangements. People will take less money for more life.
Thanks, Linda.
Did that answer that? Yeah.
Yes, I mean, I think it does point to an emerging issue in Australia too about how different forms of leave are coming onto the bargaining agenda. I'm not sure that our union rate is much lower or much higher than yours. We're only 14% in Australia now.
No, you're not that. You've got a because you've got a Labor government sometimes. So I don't know who you've got in now.
Okay. Other questions? Lisa, a fellow Canadian is going to ask the next question.
Engaging and interesting presentation for me. I learned a lot about Canada actually that I didn't know, so thank you. And a lot of what you said actually resonated for things I've heard from my friends and from my family with respect to COVID and going back to work. A lot of people, at least in the professional sense, white collar workers, are demanding that flexibility. And a few of my friends have said, I will quit my job if they won't allow me to work full-time at home or a high rate of working at home. And on that note, one organization I did read, just a comment, has actually called workers back to work, is Apple. So I read this a couple of days ago. They've actually said everyone needs to come back into the office, and the employees are not happy about that, which is surprising on one hand from a tech company. They're supposed to be innovative, but on the other hand, Apple, the way that they work culturally, it's not surprising that they want to come back into the office, but that's just a comment. My question is around the old age security and the aged, what do we call it, the Canada pension plan. So I think he said in the presentation that what people are collecting from that, when they're able to collect it, is quite sufficient to be able to keep them going financially. I wondered if you did say that. My question is, I wondered if that differs based on where they live in Canada. So for example, someone in Toronto or Vancouver where it's quite expensive to live in terms of rent, or if they may have mortgages going into retirement and other expenses that are quite high. qualify. So if that sort of sufficiency of the pension depends on where you live in Canada.
So, Linda, did you hear?
I didn't hear, I didn't hear anything, but hi. Sorry.
Okay, so Lisa, if I can paraphrase for you, Lisa was saying she found it very interesting to hear about Canada from you, and she learned a lot, even though she is Canadian. To go to the question, the Canadian pension plan, we think, Lisa was saying she thinks what you said was that the pension plan is sufficient to enable people to live, and it's quite attractive, but does that make a difference depending on where they live? So Toronto, Ottawa, are they more expensive places to live, and is the pension plan inadequate, therefore, for those people?
So there are certain places that are more expensive than others. It's indexed, I believe it's indexed for where you live, and it depends to some extent. So for example, they claw back at certain income levels. So if you're lower wage, you get it all. You get a check each month, that's it. They don't take anything back. They don't tax it, nothing. As you earn more, you get less, believe it or not, okay? And you've also got, so that's the Canadian government plan. And then many people also have their employee, so I get something from the government, okay? But I also get something from Carleton University. Okay, and so many people have managed their own pension plan. To be honest, I find my pension plan easier than yours because my cousins are always talking about superannuation, and I'm like, what the hell are you talking about? But they're talking about some weirdo pension combination. I don't understand it. But ours, depending on who you work for, you might get several pensions. I'll get something from Ontario, I'll get something from the feds, and I'll get something from Carleton. And I've invested my money in the stock market, so I'll get something there too. Now, I'm at the higher end of but everybody they have multiple sources.
Okay, thank you, Linda. Look, we're coming to the end. I have a last question, if that's all right. Take the liberty from the chair. You mentioned elder care and how important that phase of a worker's life is going to be. I'm intrigued. It's sort of a two-part question. I'm intrigued that if your females in Canada are working full-time, how are they providing all that unpaid care that you quoted was so valuable to the government? So that's the first question. And secondly, are you seeing organisations introduce specific elder care policies?
So right now, Canada's pathetic on elder care. Though we are, like I said, COVID shone a huge light on it, okay? So a lot of, one of the main reasons that people over the age of 60 retire from their job is to look after their elderly parents because they can't work full time. But we have also, though, a lot of, and I'm sure you do too, we have Meals on Wheels. We have kind of adult daycare where parents can go, they're picked up by bus. We have all kinds of stuff like that, but we certainly don't have enough. We have retirement facilities, old age homes, and you've got the same thing there because my aunt lived in a lovely one up in the Sunshine Coast. But it is a big problem, Marian, and the problem is that people feel horribly guilty. But what is very interesting, and I hate to say it, but one thing that's driving the conversation is childcare tends to be more gendered than elder care, though we've got a lot of, in many families in Canada where women are earning the same amount as men, we're seeing that quite balanced. And in COVID, that's happened even more. But the number one predictor of who's going to take on the lion's share of the elder care is not gender, it's whose parent it is. So if you're a son and your mother lives nearby, you will take on a huge load and a bigger load. And the COVID data is showing unequivocally that for many many men in their 50s and early 60s, the whole burden of elder care. So my husband, his mother's 94 in a place nearby. I mean, he took on the load.
Yeah.
Don't tell him, but I never liked his mother. And so he's doing it. But in terms of the public policy, that we don't present it as gendered over here. We say you need to do this for the following reasons.
Yeah.
So does that answer it? Yeah. And we're really discussing it a lot, as you know.
Yeah, great, Linda. And we have a question on Slido, an interesting one. Has the severity of Canada's COVID-19 pandemic led to a sense of urgency with public policy making? So,
Yes, but so absolutely, the public service has the same problem. Actually, it's a double problem. One, they have to keep their own workers. And to keep their own workers, they have to do all the things that the private sector has to do, okay, because of what's going on. And second, they have to actually provide public policy help and support in terms of a lot of employers who don't know what to do. So yes.
But if I just interrupt for a moment there, Linda, I think the question, if I'm interpreting it correctly, is the government responding? Are you seeing change in policy from both provincial and federal governments?
Well, absolutely. Like I said, Canada's stated policy now is we will have universal childcare in this country within 5 years. Yeah. I don't think you can have a bigger policy whoop than that.
And was that $10 a day, did you say?
Yeah, and the other discussions, they're having huge discussions on reskilling, huge. Okay. And the third public policy discussion, I'll be as quick as I can, is to start charging companies that replace lower category employees with robots and technology. The government is going to put a tax on robots, because if we don't have workers that will pay a tax, then we've got to somehow support those workers. So we're going to charge you. We're going to make it more expensive for you to replace people with technology, because that has a huge social cost for the government. So those are the big three public policy right now. And they're completely revamping care homes and the laws around care homes.
Yeah. Fascinating, Linda. Look, I think that last question really encapsulated a lot of the thinking and thought and interest we have in international comparison. So it's very valuable. I want to thank you so much on behalf of everyone.
My pleasure.
Here. Yeah, okay.